Ungene koi benim girlfriend you Jungu kachija Corona na kwaje Ungene koi benim girlfriend you Jungu kachija Corona na kwaje Girlfriend you Jungu kachija Corona na kwaje Girlfriend you Jungu kachija Corona na kwaje Santine magidui kore, inja tangkana paya, kanyene kanyang putwal. Indo matiengo nyantine ma pinda yane kechina, kami penye tiene pindo magene reche pasayna, ajopo payenye, tuwalaro kwaranda ipana bi, ukola biwa piaye. Santine magidui kore, inja tangkana paya. Kanyene kanyang putwal, indo matiengo nyantine ma pinda yane kechina, kami penye tiene pindo magene reche pasayna, ajopo payenye, tuwalaro kwaranda ipana bi, ukola biwa piaye. Hello
guys, share the video, share. Hello, share the video,
Indo metiye unyantine ma pinga yani kichina, kami penye tiye pindo magene reche pasayna, ajopo payenye, wala rukoranda ipana bi, ukola biwa piaye. Santine magidui kore, inja tangkana paya, kanyene kanyang putwal. Indo metiye unyantine ma pinga yani kichina, kami penye tiye pindo magene reche pasayna, ajopo payenye, wala rukoranda ipana bi, ukola biwa piaye. Ungene koi benim girlfriend you, jungu kachija, corona ne kwaje. Ungene koi benim girlfriend you, jungu kachija, corona ne kwaje. Girlfriend you, jungu kachija, corona ne kwaje. Girlfriend you, jungu kachija, corona ne kwaje. Santine magidui kore, inja tangkana paya, kanyene kanyang putwal. Indo matiye unyantine ma pinga yane kichina, kami penye tiye pindo magene reche pasayna, ajopo payenye, wala rukoranda ipana bi, ukola biwa piaye. Santine magidui kore, inja tangkana paya, kanyene kanyang putwal. Indo metiye unyantine ma pinga yani kichina, kami penye tiye pindo magene reche pasayna, ajopo payenye, wala rukoranda ipana bi, ukola biwa. Santine magidui kore, inja tangkana paya, kanyene kanyang putwal. Indo metiye unyantine ma pinga yani kichina, kami penye tiye pindo magene reche pasayna, ajopo payenye, wala rukoranda ipana bi, ukola biwa piaye. Santine magidui kore.
Okay, welcome to Lake State Media, everybody. Thank you for tuning in tonight. My name is Abraham Medik. I'm one of the Lake State Media hosts. Please, for those of you who just tuning in, share the video. I'm just welcome Dr. Mawien Akot. Welcome to Lake State Media. Thank you for accepting my invitation to the show tonight. So I appreciate you for coming in. So our topic for today is very important for us as South Sudanese because the coronavirus is a heart disease that killing people across the globe. So and it's good that you, Dr. Mawien, you accept how to come to raise awareness about what this disease is doing to to South Sudan and to entire the world, how people can protect themselves and how can we give this information to the people. So further introduce, please, all of you guys attending in a Lake State, I want to welcome Dr. Mawien Akot to Lake State Media for the first time. Dr. Mawien, thank you for coming, and I will give you a chance to you. So introduce yourself.
Yeah, thank you very much, Brother Madid. For those who are listening, my name is Mawien Akot. I'm a medical doctor with practice of over 20 years, both in Africa and in Canada. Uh, I'm so happy to be on the Lake State Media talk about this issue of coronavirus, which is affecting our world today, and especially South Sudan. For people back home, you might be recalling or might have come to see me either at Juba Teaching Hospital or at Nile Care Medical Center in Gudeli. The same thing also for my patients, those who were in Regina, Saskatchewan, Canada. So that is just in brief, who I am, what I have done. And currently I am engaged actually in raising awareness about coronavirus throughout the province of Alberta and also through the media like this to our people back home. Yeah, so for the South.
Thank you.
Yeah, go ahead.
Yeah, go ahead. Go ahead, finish
Yeah,
your
I just
next.
wanted to add that for people who are in the province of Alberta, the initiative that I am involved in is actually approved by various organizations, including the Alberta Health Services.
Thank you, Dr. Mayun. That's a wonderful thing, and this is a good time that we will bring our own doctor like you to talk to us about this, how this disease can be prevented or can help our people protect themselves from it. Because, as you know, the cases of this coronavirus is high bracket across the globe, especially where I am. And I'm in Michigan, and Michigan is one of the states that has been hit by coronavirus. So we were locked down. So our governor right now is about to open everything up, starting on Monday, next Monday. So we will start it up slow. So like restaurant, they will be started up, and they will do like table apart from 6 feet each other, and like a gym, they will open up maybe 2 weeks from now. So this, like all of this, like United States, you see that a lot of people die. The death rate is high, and you see that we had this protest going on for a few weeks now, and they were saying that more people will be dying in the United States. So as I focus with that, this is the America that I'm curious. But let me shift it to our home, South Sudan. So as you see, you were like a few years ago, you were working in Juba,
Yes.
Juba Hospital. You were one of the doctors. So and you see when this coronavirus outbreak. So Sudan right now, every day the cases are increasing. Like for today, as we speak, we have like 1,670 cases in Juba and 24 deaths. So what is going on here? What's going on? Why South Sudan having this kind of disease? The coronavirus is spreading so much, and other countries are not.
This is a very important point. When the first coronavirus cases were discovered in South Sudan, at first they said it was 2 cases, then they said it's 4 cases, and people, even some officials went on in the media and said there is no coronavirus in South Sudan. And one of the videos that I made, I actually warned our people. I said, do not celebrate, because behind every single case, there are other cases. This is something known for the viruses. So when you have one case, some viruses like SARS virus, which is related to the coronavirus itself, as a matter of fact, COVID-19 is a SARS-CoV-2. So for SARS, for every case, there is potential of affecting 3 other people. And exactly this is what is happening. There is an exponential rise in the cases. And one of the main reasons is that there is no effective testing. So when we were saying that there were no cases in South Sudan, we did not actually know, because we did not test. And as we start testing, if you see the numbers, if they test 180 people, about half of this number come back positive. It doesn't happen here in Canada or even the United States. Like the cases in the US are, much higher than South Sudan. But the test results that come positive every day is about 1 to 2%. In South Sudan, it is 50%, meaning that if the government start to test more people, they will actually find hundreds of thousands of cases. So the testing capacity of the country is in hundreds a day. Here in Canada, thousands and thousands of tests are conducted every day. But in South Sudan, you would have like 200 test results being run, because the machines that test for the virus, the PCR machines, from what I heard from the media and from the officials, there are about five devices that can detect the virus across the country. And for some other places like states, there are states that do not have single testing capacity. Take, for example, Awil. We did a live show a couple of days ago, and our people there said, we are at the border, yet if we have to test people, we have to take samples, and then we transport samples to WOW. So that is a challenge. So before we go into details of what is going on, as you mentioned, in the place that you are, there are a lot of deaths that have happened due to COVID-19. And in South Sudan lately, there is no single day that passes without us hearing that somebody has died, somebody close to you. I lost a couple of people from my immediate family, and a lot of people are mourning these days. There are 2 reasons why, there are increased death rates in South Sudan that we are seeing now. And I hope that this thing can be actually addressed so quickly so that we don't lose too many lives. As I said before, South Sudan has one of the poorest health infrastructure in the world. We have the poorest health infrastructure. Our hospitals do not have capacity to treat complicated cases. We only have 4 mechanical ventilators, not even single intensive care unit, as much as I recall. So our people were depending primarily on traveling abroad for treatment. So even though that the people that are dying right now, if they are not dying from the COVID-19, it is COVID-19 that indirectly killed them, because otherwise they could have gone to neighboring countries for medical help. But because the borders are closed, there is no movement of people across the borders for treatment. Those who have chronic diseases, our elderly, those who are sick, the diabetic, the ones with heart diseases, the ones with asthma. We see them dying. So it's really hard to say there is a quick fix for this, because you cannot build hospitals over a course of few days, unless you are China. Yeah, but South Sudan does not have that capacity to build hospitals. So why the government does not even get medical teams from abroad to help them combat the situation. So this is one of my observations, and my sincere condolences goes to everyone that have lost their loved one, and also to those who are sick. May God give them quick recovery. So we'll take it from here, and as an awareness program, I will be talking about a few things. First of all, you need to know what you're dealing with. So a lot of people may ask, what is a virus? And what is this thing called coronavirus? How does it affect me? And if I get coronavirus, what should I do if I feel sick or if I test positive? How can I safely live with my family at home and also with my co-workers at work? So some of these elements we will discuss. And then also I will discuss with you about misinformation, because now what is going on with coronavirus is there are a lot of things that are out there in the media. So with the huge number of information, people do not actually know the truth from the false. So that is misinformation. We will address that as well. So I'll be going in brief about the issues that I talked, I highlighted. So to start with, coronavirus is one of the viruses. Viruses are microorganisms. These are, small living beings, and بيقولوا الكائنات الدقيقة. They cannot be seen by a naked eye. You have to see them by electron microscope. And even before seeing them, sometimes you have to do other procedures to multiply their numbers so that you are able to identify what they are. So when somebody gets sick, they can be sick because of infection from bacteria, from parasite like malaria, from viruses like influenza, the flu virus, or now COVID-19, and there are other viruses. Those are what we call respiratory viruses. They affect the breathing system. That's the respiratory system. And then there are other, organisms like yeast that can cause infection. So for the viruses, the majority of viruses that we are dealing with right now are what we call upper respiratory viruses. And coronavirus is one of them. We call it novel COVID-19. Novel means it is new, and COVID-19 stands for coronavirus infectious disease. 2019, which year it was actually first isolated in Wuhan province in China. Coronaviruses have been there for long time. We know in 2012, 2013, 2002, 2003, we had outbreak of SARS, which is severe acute respiratory syndrome. Then again in 2012, we had MERS, which is Middle East respiratory syndrome. And then in 2019, we have COVID-19. Those are all the same family of viruses known as coronaviruses. the mode of transmission, how you get coronavirus. Coronavirus initially were diseases of animals, what we call zoonotic diseases. Zoonosis, like the word zoo, comes from, the hadika haywanat. And then, when you say zoonosis, that means it's a disease of animal. But sometimes changes happen so that the virus can leap from the animal to the human beings. The SARS was from cats, MERS was from camels, and then now COVID-19 was from bat. And we don't still even know how did it get from the bats to human beings, or was there another animal in the middle there? We don't know. But what is important now is this virus is transmitted from person to person. It's transmitted through what we call airborne transmission. Okay, so when you sneeze or when you cough, there is a spray of the saliva, the droplets. Those droplets can travel to about a meter or two. When you get in contact with those droplets through your mouth or your nose or your eyes, they get into your system. And then it goes and attaches itself first to the cells, in the throat or in the nose. That is why when the testing is done, a swab is put in your nose or your throat to isolate the virus. And from there, it goes from the upper respiratory system, upper breathing part of the lung, down to the lower part. And it causes something that is viral pneumonia. So the viruses, when they multiply so much, it then blocks your breathing system. And that is why, people get shortness of breath and sometimes may require mechanical ventilator. Otherwise, they may die. Coughing comes from the effort of your system, of your immune system, trying to get rid of the virus. So these are, some of the symptoms. But going back to how it is transmitted, we said airborne transmission. Then also there is contact. If somebody sneezes or touches a surface, virus can live on that surface, and then when you come and touch it and you touch your mouth or you touch your nose, it gets into your body and affects you. So from these two ways of how the viruses are transmitted, we can conclude that you can protect yourself much significantly if you stay away more than 2 meters from the next person, or if you see somebody coughing or unwell, don't get close to them. Avoid hugging. If you want to greet, instead of shaking hands, you can wave. It's still greeting. At the worst scenario, you can do the elbow, but that is not even advisable so much. If you wash your hands regularly, that means if you have touched the virus from the surfaces, like we said, they stay on the surfaces, you are unlikely to infect yourself. Hand washing, you can wash or clean your hands with soap and water, or you can use alcohol-based sanitizers. Now, the trick here is actually a lot of us, we don't know how to wash our hands. And it's very challenging. As simple as it sounds, it's very easy to miss. Okay? So hand washing should be for at least 20 seconds, not a minute, 20 seconds. And in these 20 seconds, you are doing 6 steps. Okay? So the palm leathering, going in between the webs, okay, cleaning the thumb, and then the nails, okay, And don't forget the back of the hand and the wrist. Okay. You can perform this in 20 seconds, and that should be enough. You know, if you do it regularly in a proper way, you will be protected. If there are contaminated surfaces, you can cleanse them, you know, with sanitizers, those things that we use to clean counters and everything at home. Hand sanitizers, you should not use hand sanitizer if your hand actually look dirty. You know, it defeats the purpose. Some people will have their hand grossly contaminated, and then they go and they take the sanitizer and they rub it and they think they are okay. No, they are not. Because of the droplet nature of the virus transmission from person to person, you can't be protected if you wear a face mask. Okay. Face mask, when you wear a face mask, you have to wear it in a proper way. It should cover top of your nose and coming to your chin. And then there should be no leaks from the sides. Okay. So if you just put it like, you know, some people want to make a decor or something, it doesn't work that way. Okay. So that's about the mask. But in actual fact, you know, and I have done a course through the Government of Canada training for COVID-19 awareness. There are concerns about improper use of the mask by the general population, and that can give them a sense of security. They think they are safe when they just throw in a mask. So ideally, healthcare professionals should use masks, okay? And also those who are sick, and I underline here, those who are sick, those who are COVID-19 positive, or those who have symptoms should wear masks. But it's not a general recommendation for everyone. And the safe disposal of the mask become an issue as well. As we have seen in Juba, people will put on masks and then when they finish from the market, they just throw it on the side of the road. That could be dangerous. So because of the importance of distancing, we are saying people should not be closer together, more than 2 meters, or more than 2 brethren. Okay. So these are some few things that you can, you know, protect yourself from coronavirus. Good use of, you know, cough or sneezing adequate. Like if you sneeze, you should sneeze in a tissue, or you should sneeze at the very worst scenario, at the bent elbow, like this. That one will actually help. Yom da kana gulte le nas betana kasra no monjing, you know, ta timran kam yoj more. Yeah. Yeah, cuma dan timan kalau ti gon matuang kita bui kayu rampit up. So those kind of practices for us, you know, those are part of our culture. But we should be mindful that those are not the right things to do now. I think we will break it from here, and then we'll go on step by step. Again, I don't want to give it as a lecture. I want it to be a little bit more interactive if possible.
Right. Yeah, thank you. Thank you, Dr. Mawien. You know, one of our sister, Josephina, she just asking you that what is the spray they are using for cleaning, Mr. Speaker? And also, too, she mentioned another comment.
What is using what?
Using, I put on the screen. She said that she asking you about the spray they are using for cleaning.
Oh, spray.
Yeah, and also too, she said that her brother just passed away, and they believe that is because of cleaning spray. Can you comment about that?
Yeah, you know, this This is a very important point, my sister. As a matter of fact, you know, for the virus, the cleaning that we use to decontaminate the surfaces, and also there are environmental sprays that are sprayed into the room to sort of disinfect it. I know this has been a very big concern in Juba in particular, and the spray that they are using, I don't know what kind of chemicals are in it, so I can't speak for that. But apparently, those who have asthma or those who have allergies or hypersensitivities, if the room is sprayed and the spray has an odor, it can cause them to have what we call bronchospasm, like the lungs will shrink and the air will not get through. They cannot breathe unless they are given oxygen very quickly. So we have seen that it happened in many hotels in Juba, and it is something that we have actually to look into as a medical community in South Sudan. See how many people from those who died, how many people are dying from the people that are coming from their own homes, as opposed to those who were living in hotels in Juba. I would like, if there is any of my colleagues in Juba from the medical field watching, they should try to make a little bit of comparison. The death rate between people living in the hotels and those who are in their homes. Does it make sense? If more people are dying from the hotels and the hotels are being sprayed, then we might suspect that there is something wrong with these sprays and they should be stopped. If we don't find a difference, then we might say, okay, that might be fine. So that is answer to my sister, and I'm really sorry for your loss.
Yeah. So I'm really sorry too. I'm sorry, Sister Pino, for the loss, for your loss. My condolences to you and to your family. It's really heartbreaking. And as you know, Dr. Mawien Akot is at work right now. I'm in the office. So whenever I go outside, because I lock my office door now, if I go outside to interact with people, I have my mask on whenever I go outside in the rear. So I put, as you mentioned before, that about the mask, because the mask of because right here at workplace we have a medical mask, which is this kind. I think this is what most of the doctors use. But as right here, you are recommended it's better to use the clothes like made mask. I ordered this one as Amazon, which is good. So whenever I step outside, I put on I wear it and then step outside. And the office here, every 20 seconds, every 20 minutes, I have to put this inside my hand and wipe my hand. So I have everything in the office we recommend. So another spray, what our sister mentioned, what we use here at my workplace, I try to look for the spray bottle.
There's a lot of echo.
Okay.
There's a lot of echo on your microphone.
Oh, okay. So can you hear me? Can you hear me well?
Not clear.
Okay. Can you hear me now?
Yes.
Okay. So and also too, what we use for spray is bleach. We put like a small little bit for bleach in the container and add water in it, and then we spray and we clean the surface. That's what we use mostly at workplace to kill the germ. So now another question to Dr. Mawien, as you were working in Juba Hospital before. So what's it like about the healthcare system in South Sudan? Can you tell us more about it?
Okay. I went to South Sudan in 2013 and I returned back Canada in 2018. I've been working there for 5 years consecutively as a consultant physician at Juba Teaching Hospital and also of course, we work in collaboration as a Ministry of Health employees. And I also had my private practice as well in Gudeli. It's called Nile Care Center. So what I observed right from the get-go when I landed in South Sudan and when I went to the hospital, I was shocked. Actually, the hospitals look more horrible than even when I left, as a young man, way back in 1986. That's when I left South Sudan. And then I came back in 2013. So I was out of the country for, over 27 years. 27 years to be, precise. So first, the hospital have no any, system. There is a chaos. People who are working, even the shift, sometimes nobody knows who is coming for the next shift. This is just very simple administrative thing. Leave alone the physical infrastructure. There are no running water, no latrines, proper ones. So people will, if a patient has a diarrhea, they can defecate there. The waste from the hospital is actually stored within the hospital. I'm talking here about Juba Teaching Hospital, and I've gone to other hospitals across the country. The wastes are stored in the same place as patients. Majority of patients sleep on the floor, not even on the bed. And if they have a bed, there is no clean bed sheet. So this patient will come and sleep on that bed. If they recover, they recover. If they die, they die. And then the next one comes and sleep on the same one without even nothing change. There is no medicine in the hospital. The hospital has become just like a receiving, it's more of a place for a bed. And then maybe you can lucky to get a nurse and you buy your own medicine. Even the syringe for injection, you got to go buy it. You buy your own drips, and then they will come and they put it for you. There is no kitchen, no food for patients. So if the patient was brought in, say, unconscious, when they wake up and they are hungry, if they don't have any relative, they can even starve inside the hospital because there is no food served to patients. I have never seen anything like this, for the most years I practiced in Canada here. And so Juba Teaching Hospital, as the largest medical center in South Sudan, is supposed to be the standard for the whole country. But again, it was not. Very, very poorly managed. Nurses, doctors, a doctor that is actually going to be on duty, say for overnight, do not have feeding. He has to buy his own water. And on top of that, he might be staying for about 6 months without a salary. So where is he going to get? So when I was working with my junior doctors, if they don't show up, I don't blame them because they have to go to find ways to survive. Nurses are coming with bed sheets, malayat, to sew them. Fi Amber, you go to Juba, I think even now you can see. Because a malaya al she will sell it and she will get food for her family because the healthcare system is not supporting her properly. At first, when I used to see those kind of scenes, I used to be upset and I tell them, no, this is a workplace. You should not, be sewing ayat henna. But then, little by little, I came to understand. The lack of training. Now we even say, okay, we don't have mechanical ventilators. Well, if we send now, say, 1,000 ventilators, and I can challenge my colleagues. Some majority, not some, majority of doctors in South Sudan have not seen what a mechanical ventilator look like, maybe in a picture, but not in real actual life. They have not been trained how to intubate the patient, how to put down the endotracheal tube to connect to these machines. So there is lack of training. There is a neglect, apparent neglect for the cadres, for the healthcare professionals, and also for the healthcare infrastructure. And this has come now to bite us. Asa, irifna, what we were neglecting, يا ريت لو كنا ضربنا دكاترة بتاعنا تدريب تمام وجبنا أجهزة اللي بيقولون ده كان الناس بتاعنا بيموت بالطريقة ده. No, but everybody in the government was busy planning. They put some money aside. They gurush bita ilaj. When they get even a small flu, they will fly to Nairobi or to Khartoum or to India or to Germany for treatment. But now, there is nowhere to go. And this should be a lesson. It's a self-reflection. I'm not here to criticize, but I'm just saying the responsibility of the government in this kind of crisis, like what we are facing, the pandemic, COVID-19, number one is to save lives as soon as possible. But more importantly, what are the plans that are put in place so that next time, if something like this comes, it will get us prepared. We are not prepared. And preparedness for the disease, even now when I give health education here, I tell my clients, you prepare even in your own house. Prepare for the worst. If you get sick or somebody in the household gets sick, what are you going to do? What are the plans that have you put in the place? For example, there should be a room dedicated to, that room will be for a sick person. That will be his or her room alone. You should have supplies like masks, cleaning supplies, adequate, food that you will not run out, because now you will be in the situation, maybe you might not be going outside for shopping. If you have somebody who is elderly, put a plan, at least okay, I'll come visit you from far away, or I'll call you these numbers of the day, and you call me if you feel this and you feel that. So things should be made in advance. Okay, even the utensils, what are they going to eat from? You put those aside. This will be for somebody who is going to be sick in my family. That is at the level of the household. At the level of the country, there should be, steps taken by the government to strengthen the care system that it doesn't collapse. The other day, I'm seeing reports here from Canadian national television about South Sudan. One of the journalists, which are journalists for human rights, JHR, they were talking about how the healthcare system in South Sudan has totally collapsed. So this is what we are facing. We have our share to blame, but also we cannot just say, okay, people that were ahead of us, they made mistakes, or we should leave this issue undiscussed. The good news now, from a medical doctor who has been practicing in South Sudan for the last couple of years, is that there has been a significant change in the healthcare ministry. The minister, Dr. Mawien Akot, has been relieved. We have a new minister, and the undersecretary, Dr. Makur Koryom, has been replaced a couple of days ago by one of the most respected doctors in South Sudan, Dr. Mawien Akot. Dr. Mawien is somebody that I work with very closely in Juba Teaching Hospital, and I commend his leadership. We have seen it during the crisis of 2013 when me and him and some other colleagues of ours were actually organizing the doctors to save lives. So Dr. Mawien is a consultant surgeon. He's somebody who is, unlike Dr. Makur, he's very close to his colleagues, the doctors. So I'm sure having a good working relationship with the medical professionals will help shape the healthcare to a better level than what it used to be. When I was there, we were just being run like an army, given orders, and if you say no, this is not correct, they label you as you have rebelled. They threaten you even with the national security. If the doctors say they want to go on a strike, they will say, okay, we are going to send in the national security, and they will silence you. So I hope with this new change, Dr. Mawien, if you are seeing me, the Jegalamar, way back in Juba Teaching Hospital when I was there, people could not differentiate between Mawien and Mawien. So they call me Jegamar and they call him Jegaswat. So he's one of my colleagues that I know very well, and I'm very, very happy. But more importantly, we are waiting for the results, for the reforms in the healthcare, not just individuals.
Thank
So
you.
I'll yield the floor for you if you have
Yeah,
any other question, my brother.
Yeah, I have a few more questions to ask you. Thank you, Dr. Mawien. Mawien, I have other question that I want to ask you about is about so what dangerous this dangerous this virus can harm? Is it can harm the newborn baby, or it is normal for the newborn baby?
This is a very good question. I have actually looked into the literature. What is the effect of the virus? The
Hmm.
youngest patient that has been recorded to have catch coronavirus was five hours old. That is the youngest patient. Now there is a concern for pregnant women,
Hmm.
because pregnant women are more sensitive. They can get really sick, and if a woman is pregnant and she becomes symptomatic for coronavirus, say they have high fever, that fever can raise the temperature, the core temperature inside her body, and it can raise the body's temperature of the child. We do know that if children are exposed to high fever while still developing, they will have what we call neural tube defect. Neural tube defect is, the back, the spine. These children are born with an opening.
Uh, is it
So
along
yeah,
the
so
jaw?
yeah, and then the effect of the heat itself,
Hmm.
can affect the unborn child. For breastfeeding, those who are breastfeeding, viruses do not get transmitted through breast milk. And I shouldn't say all the viruses, okay? Because there are some exceptions to things like, HIV and all that. But coronavirus does not go through breast milk. As a matter of fact, not breastfeeding the child can be harmful because the breast milk has antibodies, and those antibodies protect the child. So don't stop breastfeeding because you are tested COVID-19 positive.
Okay.
That there is no indication right now that people who are breastfeeding should stop if they are tested positive for COVID-19. But a mother should make sure when she's breastfeeding the child, she should wear a mask so that her breath or droplets don't go to the child and get the child infected. Or, if not possible, they can squeeze out the breast milk, put it in a bottle, and give it to somebody else that is healthy to breastfeed the child. So that's about pregnancy, newborn, and breastfeeding.
Thank you.
But those are very legitimate and very
Yeah.
important questions, by the way.
Yeah, that's a very important. Thank you for explaining this. That is a very good, because our people need to know about this thing, because and that is very important. You answer that. And the next question is about, if someone that who work or refuse, if he or she think that he's at her workplace, if she think that the place and
Mm-hmm.
workplace are safe, and safe with
Mm-hmm.
COVID-19 in South Sudan, since the most of people were testing positive. So what do you think about this, like especially
Mm-hmm.
because like here, like United States, when you are sick, even though you have a flu or like a small flu, and you will send home. So for 14 days to cover before you come back,
Yeah.
before you come back to work.
Yeah. The occupation health and safety
Hmm.
is something that is important, and employers have some obligations toward their employees. So first, if you are put in an unsafe situation where you are told to work and it puts you in danger of catching COVID-19, you have a right to refuse.
Hmm.
Employers should make sure that during this time, uh, rules are not made like really 100% strict. Like, when you call in sick, before they can say bring a note from a doctor. Okay. Right now, it's okay. They should trust. If you call and say, you know what, I feel like fever, I have this, and I shouldn't come to work, then they will advise you that, okay, you stay until you get well, and after that, bring the, shahada radiyah, who sick note.
Hmm.
There should be mechanisms in the workplace to actually separate patients from, those who have symptoms, and those who are infected should be separated from those who are not. And the best way to separate people that are infected from those who are not infected is actually to advise those who think they have symptoms to stay home. Simple as that. That is really important, and it is something that is being done here in Canada. There should be regular, decontamination, like cleaning. So what you are saying, that you have your sprays and you have your cleaning supplies, you have your personal protective equipment, and you are cleaning your work area every now and then. You are washing your hands. You are using safe work habits. That is what is advised by most health officials in Canada and the United States, I believe. And it become very important because now we are on the stage of relaunch. Matter of fact, here in the province that I'm in, we are now into phase 2. We already passed phase 1, phase 2, and then phase 3 will be in a few months. In September, we are expecting to have all the schools and the students going back to the classroom. The most, from the scientific point of view, is that we are losing the good effect of social distancing, of physical distancing. So as many people go out in big numbers, I look today in the province that I'm in Canada, social distancing has decreased by 50%, meaning that more people are getting out, they are getting in contact. So there is expectation that maybe there will be a second wave, second wave of viral infection, that we can see more deaths, more people, being hospitalized, and more cases coming. So that needs planning as well. I know in South Sudan what they did. They are actually just kind of following what the rest of the world is saying. They say lockdown. We say, yeah, we don't have a case of coronavirus, but we are going to shut down everything. And then when you have 1,600 cases, and the rest of the world say people should be going out, they say, yeah, you can go out now.
Yeah.
But what need to be done? What that is the reality, and this is where people that are appointed to a task force, like the high-level task force for coronavirus in South Sudan, they should be trained. They should be people that are knowledgeable of how this disease actually spreads. What are the behaviors of the virus? How can you do proper screening, proper contact tracing, proper the authorities know what is really going on. But unfortunately, in our country, when a committee is formed, of course there is a budget for a committee. And everybody wants to be on the committee because of the money, not because of what they can deliver to the country. And we have seen, it first started that the whole high task force level for coronavirus were actually the source of the infection. They all got infected. Hear about some strange things, Okay, Dr. Riek Machar has been released after being quarantined for days. If you are following the CDC guidelines, the Center of Disease Control, which is a very highly credible United States disease control and prevention, there are some guidelines for when to test, to isolate, and more importantly, if you take somebody, say they come to John Garang Diagnostic Center or John Garang Infectious Disease Unit, these people are put there. They are put in, in the room, just one large room with a lot of beds, no separation between patients, and they don't even know when these patients should be released or when they should be staying there. Those who self-isolate at home and those who test positive. Okay. Today, I've seen a nice comment from Dr. Mawien Akot. He said he tested positive.
I saw that on Twitter.
Yeah, but he was very sick apparently. But thank God he's doing okay. But he said he's taken a couple of days ago and it came back negative. So what does that mean? Does it mean that if you test positive for COVID-19 and then you are tested again and you test negative, then you are cured? No. We have two things here. We have test-based discharge and we have symptom-based discharge. So test-based discharge, there should be 2 negative test results at least 24 hours apart. So for Dr. Mawien Akot, I hope they have done the test. So if the 2 test results come back negative, then yes, you can be discharged, you can go home, or you can resume your things. But more importantly, if you have symptoms, even though the test is negative, it is better to use precautions. Okay? Because we do know that COVID-19 has a very high rate of false negative tests. false negative. What does it mean? It means that if I test you now and you test negative, it might be actually that you have COVID-19, but we were not able to detect it in the laboratory. This happens quite often, especially if you just have symptoms today or the last 2 days and you go and test. There is a high false positive rate of the test. Until day 5, still we can miss a lot of cases. So there is a need for frequent testing. My message here is that if you have one test result that is negative, just don't laugh and say everything is okay. It might not be okay because you might be in that window. The virus detection is very low, and therefore it could be missed by a PCR, especially what we use in South Sudan. The type of test is a little bit different. And even here, there are 2 tests that need to be run. The real-time PR, and then the quantitative test results.
Yeah, as you mentioned about the case of Mawien Akot. So my another question, but because if you test it first time and you tested negative, so or person who testing positive and they treated him or her, and then he leave, go home, and then he's COVID-19 free. So can that person get another COVID-19 twice, positive twice?
Yeah, you can act. We have seen in most of the viral illnesses, when you get infected, you can develop immunity, and it will protect you from getting another second infection. An example is chicken pox or measles, al-hisba, or chicken pox, burjum. Those diseases once in the lifetime, then you are done. So it's either it kills you, or if you are cured from it, then you are good for life. COVID-19 is not like that. We're not saying 100% that it's not like that, because it's still a new disease and there has not been a lot of studies that are done. But we have instances where patients actually tested negative and then, tested positive, then they get recovery, meaning that they can get 2 negative test results within 24 hours apart. And then when they go out again, they may get the infection and they can come back positive, maybe even more sicker. So having an infection and passing it, it can give you some good immunity, so that when you get the second infection or the third infection of coronavirus, your body actually is prepared and it can protect you from dying from it. And talking about the body protection, we have to focus on strengthening our immune system, and that is by getting proper nutrition, getting proper rest, not panicking. See, panic is one of the big things. And actually, when I look now and I see our elders, they are dying day after day. They not sometime not a long time frame. Some of them even just by receiving news that your colleague Flan and the colleague Flan have died, this thing is killing the elderly. They get scared.
Yeah.
And having that sort of anxiety and panic can actually be the measures to combat anxiety from coronavirus. Yeah, you are getting overwhelmed. Just switch off the TV. Don't watch the news. Don't go on the internet to read about it. Don't even call people that give you wrong information. Just give yourself some time. I'm not saying that you should stop doing these activities, but if you feel like you are getting panicked, then that is not the time to read about it. It's the time to stop and relax. After you relax, then you can digest the information in a proper way. At the beginning of the show, I said that there is a lot of misinformation going on regarding coronavirus. And this is something not only in Africa or in North America, but it is something that is worldwide. Because we, the doctors or the scientists, don't have answers, not all answers to people's questions about COVID-19. There is actually a growing need for information. And some people, they go online and they post things, and they make you believe that it is true. At the beginning of the pandemic in Khartoum, people said there was a child that was born and that child spoke. Kala sharabu shai al murda, corona dama bajikum. Lama nas masho so geshaif.
You are a shy.
Yeah. Some people, they say, oh, you know what? If you gargle with salt and ginger and lemon, it will kill virus from your throat.
Mm-hmm.
No. Or if you drink vodka or hard liquor, it will kill the virus. No. Some people have a lot of information going out there. Like now in Canada here, there is this issue about people taking garat. Garat, the scientific name, it has so many names, but what is used in the scientific community is Acacia nilotica. So Acacia treader, it has like 9 different categories. One of them is the one that grows along the Nile, and this garat, people are using it. Yeah, we know, Phelan, garat, when if you have cough, it can suppress the cough. We know that. It works. But it is not a cure for COVID-19. There are good benefits of this plant, but if you take it in excess, you can even harm yourself. Yeah, but nas bidana hena kan gultelom kalam ta garab de wala aden bugule kaman, if you take those things that are very bitter,
right?
Yeah. Yeah, but there is no scientific proof. There's no scientific proof. We are not saying that you should not use home remedies, but you should know that some of the things that you'll be taking can actually harm you. Like some people are taking a lot of garlic.
Yes.
Yes. And who are the basaltum. Some people are garat. And these can interact with other medications. If you are taking medications for the heart, for high blood pressure, for different diseases, it can negatively interact with them. And it can cause serious health problems. For example, garat causes clot. So if you are prone to having blood clots, you can actually harm yourself very seriously from taking garat. Some of the things that people are doing or believe to be the cause, like annexing this pandemic to G5 network. Guys, and as for Europe, in Netherlands, they went and they broke down these towers, Ariel, but at the telephonat. Got the G5 network there. Yeah, because Bill Gates can get Hajas. He said something like this is going to happen, and now it is happening. And because of the G5 network, this coronavirus is spreading. There's no scientific proof that it can cause that.
Yeah, exactly.
So, combating misinformation, when you get some information Just analyze it. Do not be fooled. Do your homework research. As health officials, go to government website. Just don't go. Just go to Google. Google. There are a lot of things on Google there. Yeah, I used to tell my patients, in Canada here, Kawajat, they like to go on Google before come to their doctor. They will come with a list of questions that we have found this on Google, we have found this and that. So sometimes I tell them, who do you believe? Is it Dr. Google or Dr. Akot? Yeah.
Like,
so don't go to Dr. Google.
You remind me about one of our doctor when we were in the bush during the war. There's one of the doctor called Mawien Akot. So when you go to him, so when you sit down, he will ask you, how do you feel today? What is the problem? And then you say that I have malaria. and then he said, oh wait, you already you already diagnosed yourself.
Well,
you have malaria. Yeah. When you say that you have a malaria, you have to know what part of your body is pain. You say, I have a headache, I have a fever, all kinds of stuff. And then he can write you.
Yeah, fever, pain.
But when you said that I have a malaria, I said, you are a doctor now.
Well, that's a little bit extreme, but yeah, but that's a good joke.
Yeah.
So for us, I'm just going to excuse you for 1 minute to run to the washroom.
Yeah, go ahead.
So if we can have a break for.
I will give you a 5-minute break. Yeah, go ahead. Yeah, thank you. So while we are, thank you guys for watching. So while we are waiting for our guest, Dr. Mawien, so we are on the break. So this is the important. It's very important that we have the information that we give out to our people, how there are false information out there. So those false information we have to see that one of our doctors to talk to us about it. So that is how it is. So we need to get this very important information that I'm learning a lot of information, good stuff, how to protect yourself from the Dr. Mawien. So please keep sharing the video. We are on break. Let me pull up some of the music that while we are waiting for the doctor. Girlfriend to you, Tingo Kachija, Corona, Nabaje, 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 Nanti de Mabito,
Yes, I'm back.
Okay. Welcome back. Thank you, Dr. So welcome back, everybody. We are back to our discussion. So thank you, Dr. Mawien. So my next question is, like, our people right now, they are so confusing. Some people, that are confusing. So we have the next question is regarding about our people. They are differentiate from like quarantine, self-isolation. So what is the difference here? Can you tell us the difference between quarantine and self-isolation? Yeah.
Yeah. You know, when somebody start having symptoms, they should self-isolate, meaning that it is you by yourself saying, you know what, I don't feel well, therefore I'm going to stay home for duration, which we know as an incubation period of the virus. The coronavirus has an incubation period between 1 to 40 days. So if you get in contact with somebody that is sick with coronavirus, you get infected, you can start having symptoms as early as day 1 or as late as day 14. But if you pass this incubation period and you are okay, chances are you are fine. That is where self-isolation comes in. For the quarantine, it could be something that is imposed by health authorities or by the governments. For example, here in Canada, if you come from abroad, you are ordered to quarantine for 14 days. That is actually a law requirement that you should do. If you break it, you can be sentenced, you can even go to jail because you are a person that is deliberately wanting to infect people. So if you come from outside of Canada, you are required to stay in one place for 14 days, right from the airport. You are not even allowed to stop for the gas or to stop for shopping. You get quarantine. Compliance was very, very important. It is monitored, but more importantly, it should be, something from yourself. If you are not doing it for you are saving the world by doing that. You are saving your elderly. You are saving your sick ones. The worst thing that we see in South Sudan is, number one, preferential treatment. If somebody that is a high profile comes from abroad or their family comes, they don't subject them to the same measures like other normal people. That's wrong. This disease doesn't differentiate between poor and rich. It doesn't differentiate, between a minister and a messenger or morassel. It affects all, and we have seen it has affected our first vice president and many, more officials in the government. For the citizens, when they are put in quarantine, they actually escape. I think that happened in Warab, where 20 people escaped. And it's happening in a lot of places. So when these people escape, there is no way to actually trace who they have been in contact with. And therefore, you will not be able to test these people to see if they have been infected by those who have escaped from quarantine or not. So terminology is one of the confusing aspects of coronavirus, like things like self-isolation, quarantine, self-monitoring. That's another thing. You monitor yourself, see if you develop fever, you develop cough, you develop shortness of breathing, you develop aches and pains. Then you need to call your doctor before you even go to the hospital. Make a phone call. I feel I have these symptoms. Mata gulana indi COVID-19, zebta zola gulana indi malaria. You just tell them what you feel. Yeah, you tell the doctor your symptoms, and then they will decide whether this is COVID-19 or this is not.
Not exactly.
So that they can directly either you go to the office, to be checked, or you go to the emergency room, or even they can advise you to call 911, get the ambulance, so that you can be helped. So terminologies around COVID-19, some of the other ones that you may have questions, but people say outbreak, they say epidemic, pandemic. So these terminologies need to be understood very clearly. Outbreak is when an illness happens more than the usual. Okay. So, for example, in winter, we see people having flu. Nazalat and Alberic visit flu. But if this flu affects so many people, more this year than the last year, then we can say there is an outbreak. So outbreak is just like an epidemic, but in a shorter scale, lesser than epidemic. Epidemic is when the disease happened in a certain location in a very short period of time. The pandemic is when the disease affects so many countries. It crosses borders. Like now, COVID-19 has affected over 200 plus countries in the world, countries or territories. So that is the pandemic. Epidemic is a smaller form of pandemic, and then outbreak is a smaller form of epidemic, if that makes sense.
Yes, it's true.
So when you read about these terminologies, or when you hear them in the radio, this is what is meant.
That's true. And and this is the reason why I remember. Yeah, go ahead.
There was one thing, there is this website. It's a safety training, and they give you like a certificate when you didn't print out very well for my certificate, but it is about coronavirus awareness. You can access it for free. I will send the link for you.
Okay.
It's a very good website to go. There are trainings there, and this particular training for awareness of COVID-19 is actually for free. But you have to register, and you can access it for free. You can do the whole course. It's 5 chapters, and after that you can take a test. When you finish that test, they can give you a certificate of having awareness on COVID-19. Send the link to you later on when we finish, and maybe some other time you can post it to your viewers.
Yes, definitely, no doubt. Yeah. So I will do that. I will post it. If you send them, I'll post it. So
it's a incredible government-approved website for Canada, and the training there is really nice. Yeah, it's in short, form of videos and slides, about 5 chapters, and then a quiz.
Good. That's a very good. That's a good.
Yeah, there also
Mm.
yeah, there are also other resources online. Like if you go to Government of Alberta Health website,
Mm.
there are self-assessment tool for COVID-19. So it will give you some questions, and you can answer these questions. If you score this way, it will tell you whether you have likely to have COVID-19 or not. So it's another good tool to access online. There are a lot of sources, credible sources, rather than what you can just access randomly, from Facebook or WhatsApp or Twitter.
Mm.
So as an educator, I'd like to, people to know that these resources exist and you can use them.
Yes, that's wonderful. That's a good information people need to know about those, so they can know. So the resources that they can know how to protect themselves.
Yeah.
Yeah. So when we like last year, like you are in Canada, I mean, in the United States, we have this information that how we can educate ourselves to protect ourselves about this coronavirus disease. But back home, like South Sudan, our people have zero chance to get these important resources. So, what is advice you can give to your colleague who are fighting COVID-19 in Juba right now? People who are on the front line try to contain this disease. What is good advice you can tell them?
Yeah. It's actually very important.
Hmm.
Even so, more important for the healthcare workers or those who are, in the front line to have better understanding of how this disease is transmitted, how they can protect themselves, and even have much higher knowledge than the average person. Uh, like I said in the beginning, we have one of the weakest healthcare systems in the world. The the death rate, the child mortality rate, infant mortality rate, maternal mortality rate, meaning how numbers of children, those who die during the first year, who
Hmm.
are infants, those who die before 5 years, or those, mothers who die having babies, we record higher in the world. We even surpass Afghanistan. So our
Hmm.
healthcare infrastructure is weak. There is poor training for healthcare cadres, and sometimes they are thrown into situations without being properly prepped or prepared. They, they don't even know their rights to say no. I have seen it when we had cholera outbreak in Juba.
Hmm.
There were tent constructed in Juba Teaching Hospital for cholera patients. And people were, racing. They were very, very eager to work in that cholera control center, not because they know what it is, but because every day they were given financial incentives, money. So even somebody who does not know rules of isolation, does not know how to protect himself or herself, would go there to get the money. I tell you, my colleagues, if you do this with COVID-19, you are committing a big mistake. Isolation, strict isolation, is something that should be followed, and also the protective measures that we've talked about. But when we come to the healthcare professionals, they even have an added more requirement for protection, like the mask that we would use as doctors or nurses is N95 N95 type of mask. This N95 type of mask is a mask that should be actually test fitted. You know, when it is test fitted, they use orders. Put in the room, you wear different sizes of masks, and the odor is pumped, and you would smell it until you are not able to get that odor. That means there's a good seal for the mask, and you are given that number. That will be your mask. When you come in, you will be given that, and it will fit you properly. If you lose weight or you gain weight, you need to be test fitted again. For the gowns, the clothing that you wear, you interact with patients. Moving from patient to patient, you should change. You cannot come in the room, wear an isolated patient with the same kind of gown and mask, go and attend to the patient, and then leave and you go to the next patient with the same things. You will be actually, contributing in transmitting the disease from patient to patient because you contaminated and you will be the one going to transmit the virus to the patient who would otherwise be a normal person. So these are, critical points that our healthcare system need to focus, proper training of the medical professionals, and providing them with what they need to do the job. In 2013, when we had mass casualties in Juba Teaching Hospital, we ran out of gloves. So you are obliged to work on the patient without having gloves. And this is somebody who's been shot bleeding, and you don't know what they have. They might have any other communicable diseases, HIV, what. But doctors are supposed to work barehanded. And if you refuse, the people that came with the patient, some of them are soldiers. They will say, you have to save this person, whether it's a risk or have to do it. So medical professionals in South Sudan are in danger. They are not well trained to deal with this kind of situations, but it's not too late. We can start doing that. We can start doing even small seminars so that there should be procedures and protocols in place. It's easy for the hospital if you have a protocol. Hey, if a patient comes with this and this symptom, they should be channeled this way, this way, this way. So everybody on the team knows exactly what to do in that situation. And if they don't know, then they can ask their senior colleagues to give them some more guidance. Nowadays, there is, this kind of platform where you can get information online or by phone, telehealth, internet health, and the resources are there. There are a lot of South Sudanese doctors who actually at a very high level in different countries in the world. But we are not using our resources, our own resources. On the contrary, I might run and get somebody from the nearby country and who would rather claim to be an expert, but they don't know what they're doing. So we should be having a little bit of faith in our own. With the new Undersecretary now, Dr. Mawien Akot, who is very highly respected among medical community in South Sudan and beyond, I think we shall have a good working relationship. I'm happy that South Sudanese doctors in the United States have formed an association, which is actually a task force for COVID-19. It's their own initiative. Those of Dr. Watt are on that team, and they have invited me to be a part of, of that group. We here in Canada also do consult from time to time on how we can help our people back home. All of us, we need to help, and we need our people to be safe. We don't want any family to go through sorrow, losing someone for no reason. We want also to have our input so that reforms, the much needed reforms, are done, help the healthcare system navigate in a smooth and proper way. So I'm really thankful for the Lake State Media for bringing me on to give such an awareness on COVID-19. There are a lot of things that we could cover, but I'll leave the floor to you so that if there is somebody else that has a question, they are more than welcome to.
Yeah, thank you, Dr. Mawien. Yes, now you guys, for those of you who are watching, thank you for watching my question that I put it into Dr. Mawien. I am done. If you have a question, I will give 10 minutes because it's getting late and I don't want to hold Dr. Mawien that long. So if you have a question for Dr. Mawien, you want to join the show, I pin down the link. You can come, or if you want to write something, has on comment site section, I will bring your question up on the screen and Dr. Mawien can answer it for you. So the question now, the floor is open for you guys. You have a question for Dr. Mawien, please write on the comment section. I will bring it up on the screen and Dr. Mawien can answer you. Or if you want to join the show, so please click the link and you can be able to come in. So that is what I want to tell you guys. So thank you everyone for watching. So I want to see who's if you have any question for the Dr. Mawien, please write. I will bring it up. So Dr. Atongkon, Dr. Atongkon was asking that is that yeah, I don't want to bring that one up. So let me see this. Okay, Martin Arob asking you, he said that what advice you could give to our community members in the countryside, how to protect themselves.
Okay, this is one of the very, very tough questions. The reason it is tough is because the efforts to combat COVID-19 in South Sudan are more centered around major cities and towns. And people in the villages are not rich. But yet what happened, there is actually cross contact between people who are in the cities and people who are in the countryside. For people who are in the countryside, we can tell them to use the same measures like what we've spoken about. And then I think social distancing or physical distancing is a little bit feasible. Uh, like people who stay in the cattle camps.
Mm-hmm.
they stay as a group, but sometimes, you know, they have too much space than what we have in the cities. We can encourage them to have that space. We can encourage them to use good, proper hand washing, and if they don't have running soap and water, because that could be a challenge in the countryside.
Right.
For somebody to find soap, yeah, sabun ashan yaksal yadu. Some places there is no sabun, so we can use the old measures of sanitizing our hands. Like before, you know, when I was in South Sudan as a young man, in the cattle camps, sometimes we used this kit. You know, that's like the cow's urine,
Mm.
or sometimes when, you know, ashes. Yeah, with the ashes, you can rub your hands, and that can kill some of the viruses. Uh, the most important point for them to know is that if somebody is coming from the city or from, you know, a different country, please let them stay in one place alone for 14 days, because we have people that leave from the cities now. Some people are scared. بيقولوا جوبا ده يا أبغى محل بتاع coronavirus that. So I'm going to run, hide my children, my elderly people in the village. And that can take the disease from the city to the village. So my advice is, if somebody has to come in from this city or from another country to the village, just put them in self-isolation for 14 days. When there are no symptoms after 14 days, then you can mingle with them, you can, you know, have contact with them. But if it is made as a standard precaution for the whole villages in South Sudan, that any person coming from city, especially from Juba, must self-isolate, I think we can save a lot of lives. And that message our people need to know. And it is not new to, you know, to the African tradition. When there are, you know, pandemics like this, when there are diseases that are not curable, people tend to isolate. For example, when there was high rate of death from this tuberculosis, people knew that they drink the same cup that the person with TB has used. The message can get to the countryside, and the most important thing is that we should limit getting the disease from the cities to the countryside. So if you are a person that is living in Juba and you want to go home to your village for any reason, please self-isolate for 14 days. That will protect you, that will protect your, and that will protect your community. Thank you.
Okay, thank you, Dr. Mawad. I have one question here. So that is the second question coming from Connie. He's asking you about, I put on the screen. He's asking you that question to Dr. Mawad. How all doctors of South Sudanese outside South Sudan will be out hospitals across the South Sudan?
We can help in many ways. We can help in many ways because we are like ambassadors to our respective countries. We the South Sudanese doctors in the diaspora, whether be it here in Canada, United States, Australia, Europe, we are in a better situation to help our health system by asking good wishes in these countries that we live in, the governments, that look, our health care is poor, we need help. There are a lot of things that could be done, and we have done it during 2013 crisis when people were short and we were short of medicine, we were short of uh, surgical supplies, even wheelchairs. I called to Canada and I told them, my people are dying and we need help. They shipped a cargo full of medicine, full of surgical equipment, even the wheelchairs. And it was brought to us in South Sudan. We did not pay any penny. For equipments, some of the equipments that are thrown away here from the hospitals, they are still in good use at the standard of African way. Even the beds, we can bring more beds, bring more nurses, bring more testing equipment, bring more medications. I know I have worked in the past with Health Partners International of Canada, and they continue to ship medications to South Sudan to be delivered for free until today. And I encourage anyone, if you are in Canada here and you need, medical supplies to be or medications shipped back home, now it might be a little bit difficult because of the COVID-19 travel ban. But if things open, you can apply. Yeah, and they will deliver those medications to your door. Then it will be a responsibility for you to ship them whichever way you want to South Sudan, to wherever you want them to be shipped to.
Thank.
We as
Mm.
we as medical doctors from South Sudan have been exposed to different level of healthcare system, have a role to play in training. Yeah, I don't need to go there for some more 5 years, but I can go for a month or two, do some workshops, and train more people, and then these people will train the others. So these are some aspects that we can help. And thank you. That's a very good question,
Yeah.
my brother. Yeah.
Yeah. Thank you, Dr. Mayuen. So the last question coming from Garing Madul. So he said that he missed the point about he wanted you to talk to tell him about the effect of having a blood pressure and take a grant. So I think you mentioned you talked about it before, but he came late, so you want to know more.
Oh yeah.
Yeah.
Oh, okay. Yeah, and I'm saying, because of uh, uncertainty, because people don't know what is right and what is wrong or treatment of COVID-19. There are a lot of information that are going on in the social media. I have seen, I think it was a one Saudi doctor who came online and, he was actually saying that he does believe God treats COVID-19 and he has patients that he has treated with that. There is no scientific proof that is a remedy, that is a treatment or cure or prevention for COVID-19. I acknowledge that Bharat have some good benefits. It has been used for centuries for treatment of things like cough and upper respiratory illnesses. Yeah, but if you take too much Bharat and you are using medication, say for high blood pressure or for heart disease. Okay, for example, Garat can cause clotting for the bleeding to stop. So you're not bleeding anymore. The way it does that, it makes the blood thicker to close the hole where it is bleeding from. Somebody who has high blood pressure and heart disease put on aspirin to make their blood thin. So if you are taking Garat, you are actually opposing the effect of the medicine that you are taking to protect you from having a heart attack.
Mm.
Leave apart, there are a lot of drug interactions that we know. But this is just one example. If somebody have to have a healthy heart and they are taking medications for high blood pressure to lower the blood pressure and to take things like aspirin, which can make blood thin so that there is no blockage in the arteries to cause a heart attack or a stroke. If you are taking garab, you are opposing the effects of those medications and you are putting yourself at risk. So I hope that answers your question, my brother.
Yeah, thank you. I have two more questions, then we can end of the day. Martin is asking you, I put on the screen, Martin Arop, he asking you that will this virus continue to infect the people in South Sudan even though the world got rid of it? If the social distancing is observed in South Sudan, or it will die later by itself?
Well, nobody knows the answer. How long this thing is going to last is actually uh, a matter of speculation. Now we don't know if this virus is going to fade away by itself, or is it going to infect more people and more people will die. I think the projection, according to the rate that this virus is spreading and the number of people dying, we will still see increased levels and even much more levels of infection, levels of death, because the social distancing now not being observed strictly, like when the virus first started. Uh, the problem here is with the economic quarantine. If you tell people to stay home and you don't have a timeline when this thing is going to finish, our best hope now is for the new vaccine that is being developed. We are expecting it to be there within uh, 14 to 16 months. So it's still a long way to go. The clinical trials where they are testing the medications and antiviral drugs to treat coronavirus are, being encouraged by many countries in the world. There is a lot of research activities going on, and I'm glad to announce that I'm part of actually a research group in the project called Illuminate Project, which we are doing here in the province of Alberta. There are about 13 doctors and scientists, including myself, doing this. So we don't know when this thing is going to get over. And you cannot keep people locked up for indefinite time. They have needs. And even countries that have good social support like Canada or US or countries that can help their citizens. South Sudan, people live day by day to go and get food. So if they live day by day, to get food on the table, and you are not giving them anything, and you're telling them to stay home, they're not going to stay there. There are other dynamics, like what we have seen in the United States, when a black man called George Floyd was killed, and people went out for demonstrations. They went out in demonstrations in different cities across the US and Canada here, even the city that I am in. So human beings cannot be controlled very strictly.
Yeah.
So what is going to happen here is that we will see cases of virus going up, and then we will do a lockdown again, and then we'll do it in waves until a vaccine or a cure is found.
Okay, thank you, Dr.
Yes.
Mawien. So our last question for the night is come out from Adun Makur Atarbe. He asking you, what do the funeral homes workers need to know about the handling the disease who had the COVID-19 in Africa, South Sudan? This is a very good question.
Yeah, you see, this is a very interesting area.
Mm.
Couple of weeks ago, somebody called me from South Sudan. He said, we had a relative that died from COVID-19, and people were afraid to even put him in the coffin. So this young man volunteered to carry his uncle into the, put him in the coffin. And then when he went home, he was in panic. So he called me, said, Doctor, what is my risk here? And this, I think, this is the question for our sister, Adut Makura Torbe, is that, does coronavirus transmit from a dead person to a living human being? I think that would be a question here, first question that the funeral home need to know. If somebody had coronavirus and died, what are the chances if I touch this person that I can get the disease? The logic will say that if this virus has killed this person, that means it must have multiplied in very big numbers to the point that it overwhelmed this person and killed him. And therefore, it should be a very high source of infection. But the good news is, once a living cell dies, once somebody dies, the virus dies with him or with her. So there is no proven transmission from a dead person to a living person. Having said that, the early hours of death, a lot of precautions need to be done, because somebody just died, their cells are shutting down, but they might not be completely dead. So there might be an activity of the virus, and the process of death involves a lot of things. Sometimes there might be secretions coming out from mouth, from nose, and from different places in the body. So strict precautions should be used, but funeral homes should not be forced to wear these, big abrols mask shunu kede kaanu nasal machine fi space. I've seen some riots of somebody who has coronavirus. Even they take him with the, بيقولوا شنو ده زي القلابة كده بيخطوا براه هناك. I think that is not necessary. Just to touch a little bit on this issue, our people who are dying, especially those who are dying in Khartoum, those who are dying in Egypt, those who are dying in Juba, they are being transported back home for burial. The danger here is not the person that has died. That is the problem. It is those people who will accompany the casket, those who transport the patient, the dead person, back home for burial. And also the big gathering that is going to happen when these people bury somebody, and most people that get transferred back home for burial are leaders in their communities. And we know, as South Sudanese, during time of death, people come together and people come in big numbers. So my concern here is that such thing may actually help in, taking the disease to the city, to the countryside. It will actually propagate the spread of the virus among our people. And my advice should be, if somebody died in Juba, they should be buried there. If you die in Awil or Rumbek, you should be buried there, regardless where you're from. Because taking the bodies back home or to the villages is helping spread the virus to the places where it wasn't before. But that's a very good question, Sister Adut.
Yeah. Thank you, Doctor. The last question it come out from Marlene Maku. Marlena Maku. I put on the screen.
Yes, there are the scientists actually have come out very, very strongly, and they have warned. And I know one of the top Canadian public health scientists here have said, if we continue doing what we are doing here, we will see more deaths, more waves of death, maybe in September up to November. Because now we are taking away the social distancing. People are getting more lenient, thinking that life has gone back to normal, and number of cases, number of contacts will come. But why do they say like September? Because those are based on projections. Projections that we do here, some of them are done by computer modeling. We assess them based on 3 criteria. We see the number of symptomatic, and then the number of infected, and the number of people that recovered, and those who are removed, or in the other way, those who are dead. If you take all these 3 elements together and follow the trend of the disease in the community, you can predict what is called best case scenario, meaning what are the less numbers that we can get for infection and death, and the worst case scenario, which will be how many numbers will actually be highly, in the range that we were not expecting. The scientists are predicting that this wave will happen, and it is based on observations from previous viral infections that have happened in the past, like the Spanish flu in the late 90s. In the early 90s. Spanish flu came in 2 waves. The first wave was just like what is happening now, but the second wave is actually what almost affected the entire Europe and the world very badly. So we hope that is not going to be the case, but preparing for the worst is actually the best approach, rather than just saying let things go. One of the things that people hope for is what we call herd immunity. Herd immunity is the immunity when majority of people get infected, majority of people recover, those who will die, those who are who have a strong immunity will live. Yeah, but that is a risky business. If we are saying let everybody out, let the virus affect whoever is going to affect, and let it kill whoever is going to kill, and the rest who live will will carry on. So you can see that is a little bit it's not the best thing that we should be planning for. We should be planning to keep the infection levels low until we find vaccine or until we find medication for cure.
Thank you so much, Dr. Mawien. That's a wonderful thing, and thank you for viewers for putting in questions so that the doctor can answer them, because this is very important show for our people. For those of you who are in South Sudan, can watch this video. This is important so that you can learn properly, because you have to listen to the Dr. Mawien. These are very important than the information we need. Dr. Mawien, so thank you so much. I will give you your last word, and then I will end the show.
Yeah, thank you very much for the Lake State Media. I'm really happy to interact with you, to talk to you about coronavirus or COVID-19. Our concern is the higher level of infections that are happening in South Sudan, high number of death rates. People are dying either directly from coronavirus or indirectly because they cannot get proper medical care for their pre-existing conditions, especially those who are depending on foreign travel abroad for treatment. It is our hope that there will be collaboration between healthcare professionals outside and inside the country to help the current uh, National Ministry of Health and respective state Ministry of Health so that we can save lives of our people. For me, as Dr. Mawien Akot here in Edmonton, Canada, uh, I am in support of most of the efforts that are being done, although they are not enough. And I can offer my advice for free if needed. I encourage our people at home, especially the healthcare workers, to access resources online from credible sources. These sources should be government-approved websites so that you don't get misleading information. Lastly, there are a lot of rumors that are going on. Before you believe in something which you read or which you saw or somebody talking about it in the media, check it out again and again and find the correct information so that you don't end up using things that cannot help you. They might actually harm your health, like garat or shai al-mur or basal tum and all these things that people are using nowadays. Gargling with hot water and salt or ginger, it does not harm, but it's not going to protect you. So the best way to protect yourself is to keep distance from others, wash your hands regularly, cough into your tissue or your belt elbow, and if somebody has an infection or if you have a way to wear a mask, wear that or gloves. With this, I say I wish all of you to stay safe, and I would be glad to come on again any other time when it's needed or when the new information need to be shared with our people in the South Sudan. Lastly, I want to say that we have partners with different health organizations across the province of Alberta, and I will be producing YouTube video clips that are government sponsored to disseminate information out to our people. Also, there is a research underway that I'm part of in the province of Alberta here, and I might be reaching out for you if you are within the province for your input. Thank you all. God bless you, and have a good night or a good morning wherever you are.
Thank you so much, Dr. Mawien, for wonderful insight and give our information. Thank you. It was a very great show, and I'm looking forward to see you again on Lagos State Media. Thank you so much, and I will
Thank you.
keep on hands. Everyone, be safe, be safe, be safe, all of us, be safe,
You
because we
too.
are not, we are opening up, so be safe. Every wonderful name. May God bless you all. Thank you.
Bye, bye, bye.
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 Thank you, everybody watching. I appreciate you all for coming in. Be safe, and thank you, Dr. Mawien. This was a very wonderful show and interview. Please, for those of you watching the show, those who just came late, please go back to the video later and watch it, all the show. So it is a very good information that you need to learn from how to protect yourself from coronavirus and information that Dr. Mawien give it to us. And those of you in South Sudan, please make sure that if you need some inside information from our doctors in overseas, in US or Canada or Europe, somewhere in Europe, please make sure that keep in touch with this doctor. They have a good, reliable information that you guys can do the work while you are fighting coronavirus in South Sudan. Thank you guys for watching. Have a wonderful night. May God bless you all. Bye.